I have explained in the previous video how can differentiate clinically between the cerebellar and sensory ataxia. In this video, I will mention the differential diagnosis of each one. First, what are the causes of cerebellar ataxia? It depends on the site of lesion, whether affected the cerebellar hemisphere or vermis. Is it unilateral or bilateral? The disease onset and the progression, whether acute, subacute, or chronic. The causes of unilateral cerebellar ataxia of acute onset include ischemic stroke, hemorrhagic stroke, demyelinating disease like multiple sclerosis, cerebellar abscess, or infections, either viral or bacterial infection. It is very important to notice that sometimes the symptoms could appear few weeks after the viral infection. Then, subacute or chronic unilateral cerebellar ataxia can be caused by posterior fossa space-occupying lesions like cerebellopontine angle or brainstem tumors, metastases, or vascular malformations. Then, what are the causes of bilateral cerebellar ataxia? It can be subdivided also to acute, subacute, or chronic. The acute onset of bilateral cerebellar ataxia, it is most likely drug-induced, including alcohol intoxication, illicit drug abuse, lithium, anti-epileptic medication including valproic acid, carbamazepine, phenytoin, barbiturates, and benzodiazepines, antibiotics like colistin. Subacute onset of bilateral cerebellar ataxia can be caused by paraneoplastic cerebellar degeneration, alcoholic cerebellar degeneration, hypothyroidism, celiac disease, and Creutzfeldt-Jakob disease. The insidious onset of bilateral cerebellar ataxia with the chronic progression can be caused by Friedreich's ataxia, ataxia telangiectasia, spinocerebellar ataxia, cerebellar type of multisystem atrophy, Dandy-Walker syndrome, and Arnold-Chiari malformation. Then, the causes, the differential diagnosis of sensory ataxia. The most important cause of acute sensory ataxia is Miller-Fisher syndrome, that it's a variant of Guillain-Barré syndrome, while the causes of progressive sensory ataxia is broad. To facilitate it, we can divide it into subgroups. The first group, myelopathy. The disease that can cause myelopathy including compressive myelopathy like spondylosis, vascular myelopathy, and myelitis. Then demyelinating disease that can affect the spinal cord like multiple sclerosis or can affect the peripheral nerve like CIDP. Third, infection disease like tabes dorsalis or HIV myelopathy. Fourth, nutritional causes like vitamin B12 deficiency, folate deficiency, pyridoxine overdose, or copper deficiency. It is very important to suspect copper deficiency in patients who underwent gastric surgery or overuse zinc supplements. Fourth or fifth here, peripheral sensory neuropathy like diabetes mellitus, uremia, alcohol, paraneoplastic, paraproteinemia, medications like phenytoin, metronidazole, or chemotherapy. Last, there are some diseases can cause combination of cerebellar and sensory ataxia, and these include Friedreich's ataxia, alcohol, and celiac disease.